past week, thousands of people have enrolled in the federal and state healthcare exchanges set up under the Affordable Care Act, also known as Obamacare. Now, there have been some success stories as well as reports of others not being able to get through the system due to technical glitches.
However, while millions of the nation's uninsured hope to soon have affordable health care coverage, others here in Alabama who already had insurance are now getting letters indicating their premiums will soon double. WHNT News 19 has come as a shock to many of our viewers, and Daniela Perallon actually talked with several of them today. She joins us now live. Daniela, what are those folks telling you?
Well, Jerry, Clarissa, many people who already had insurance thought nothing would change when the Affordable Care Act went into effect this year. But now some are receiving this letter from Blue Cross Blue Shield of Alabama. It states that to stay in compliance with the law, they must expand coverage, which much of us knew, but also that they have to incur the cost of taxes and regulations put in place. Now those costs are being felt by some of the insured.
It was devastating. I cried. I mean, we have worked our budget so tight to pay off credit card debt, get ahead on the car loan, try to transfer the mortgage to a 15 instead of a 30, and for what?
Stay-at-home mother of 4, Courtney Long, was shocked when she received a notice from her health insurance provider, Blue Cross Blue Shield of Alabama. The letter stated that come January, she would be automatically enrolled in a new health insurance plan. Under her current plan,
it was $352 a month, $40 copay, $1,500 deductible. All routine care for the kids was included prior to the deductible.
However, the new plan
is $796.54.
Her story is not unique. WHNT News 19 received calls, emails, and Facebook messages from people who received the same letter, alerting them their premiums were set to double. Robbie Zirkelbach, spokesman for policy advocate organization America's Health Insurance Plans, or AHIP, which represents health insurance providers, says prices are going up as insurance companies work to comply with ACA regulations.
The law requires that all policies cover a minimum set of essential health benefits, many of which are not included in policies today. So people are going to be getting policies that are more comprehensive, but the coverage is going to be more expensive as a result.
The insured will also now be taxed for their health insurance.
That's going to operate like any other sales tax and add to the costs of health care coverage. That's something our industry thinks should be repealed because it's undermining the goals of health care reform.
Now that tax is to the tune of $100 billion over the next 10 years, and Zirkelbach says that tax will add an extra $360 to the average family's premiums. And at the bottom of this letter I showed you earlier, it says a portion of the cost in these new higher premiums is to pay for those taxes. Live in the newsroom, Daniela Perallon, WHNT News 19.
Thanks, Daniela. And if you'd like